Hello, and welcome to Back to Basics Virtual Massage. During these crazy times, call for crazy measures. Kind of a crazy girl. So what I decided to do was to help as many people as I can. Even though it's not hands on you, I can talk you through what to do, and you can work on yourself. So we're going to start with low back pain. I have seen numerous posts on Facebook about people who are in pain and discomfort. It's negatizing, it's energy sapping, and it makes me very sad. And so I want to help. And how I can help is walk you through steps that you can do at home. So what you're going to want to do is be on the floor. Let's say you're experiencing low back, hip pain. What you're going to do is start with, if you don't have any tools, you can use your knuckles, and you're going to literally start at the knee, and you're going to knuckle your way up your leg. Just slow, moderate pressure. What this is doing is flushing your quadriceps, your adductors, and your abductors as much as you can. I know the pain is back here in the low back. I know the pain even might be in the glutes, but we're going to start with the quadriceps and with the whole thigh area. So you're just flushing with your knuckles. If you have a tool, these are available on Amazon. These are available at Meyer. Many of you already have them at my suggestion, and if you don't, you can use whatever kind of roller you have or your knuckles. This feels, however, much better. So I'm going to use this tool since I have it. And you're going to roll up your leg. It's even more comfortable if you can lay down. Raising that leg up, just kind of rolling this through. You'll roll the backside, the hamstring. If you don't have the tool, you can use your fingers to kind of knead behind your leg, again, drawing towards your core. Towards lymph nodes that can help filter and push that waste, lactic acid, inflammation out of the leg. This is all to help the low back and hips. Next, what I would suggest is you can use your fist, or better yet, if you have a tennis ball, that would be wonderful, or better yet would be the back knobber tool, which I'll show you how to use. But with your fist, let's say you don't have anything. With your fist, what you'll do is you'll gently lift up your hip, place your fist in the back. Let's say the back pain is in the middle or low or even in the glutes or even on the side. I want you to take that fist, put it in the back of the meaty part of your hip, your glutes, and you're trying to find a good hurt spot. When you find that, I want you to try and let your body relax down as much as you can. I want you to focus your energy on the spot you're compressing into. And hopefully the only thing that's contracted is your fist that's in the back pushing up into your hip. You'll take a nice slow deep breath. Focus on that area. And when you exhale, I want you mentally to give instruction. I want you to talk to your muscle. I know that sounds odd, just bear with me. I want you to talk to your muscle. I want you to tell that muscle, thank you for working so hard for me. But I want you to give it permission to turn off. So again, one more time, nice deep breath. Focus on that area. Give it permission to disengage. Feel yourself unclench that muscle tissue that you're pushing up into. And you'll do this for 1 to 3 deep breaths. You'll gently lift up, move your fist to another spot, same side. Or again, I'd rather have you not use your fist. I'd rather have you use a tennis ball. You lean back, and this needs to be on a hard surface. A sofa, the bed won't work, it's too smushy. So you'll need to be on carpeted padded floor, or like I have a couple of yoga mats down. Move the ball to another good hurt spot. Position yourself on that. Let your body weight push into the ball. Nice deep breath, mentally focusing on where you feel the ball compressing. You're giving that muscle permission to disengage, to let go, to unclench. Reach back, move the ball again. You may even want to roll a little bit on your side. You're looking for good hurt spots. This is what's going to help release those muscles that are so hypercontracted.
pulling on your sacrum, pulling on the crest of your ilium, which is your hip bone, causing imbalance. Muscles react and respond to one another. So this is what I want you to do. If you have a back knobber, you would take the back knobber, place it underneath your hip, and then you lever the tool up, and it holds into that spot. The only thing, again, that should be contracted is the hand that's doing the pushing of the lever. This also is available on Amazon. It's called a back knobber. Back knobber 2, actually, excuse me. So those are some tools that you can use. Next, for, again, low back hip pain, I'm going to have you do what's called work your seams. Working your seams is the seam of your pant on the outside, the seam of your pant on the inside. We'll start with the outside. And we're doing all this just to the left leg. You can do both legs as needed, whatever feels best for you. But what you're going to do is you're going to place your fingers on your seams. Even though you're only going to be compressing on the outside to start, you're placing this hand here so your leg doesn't roll away. So place both hands here. Using your outside hand, you're going to compress into your seam. You're looking for bruisey, tender, good hurt spots. So you'll compress gently, move a little bit, and when you find that good hurt spot, allow yourself to relax. And again, you're giving that muscle, you're giving that spot instruction to disengage. You'll move up then from your knee towards your side, holding, breathing, disengaging, getting those muscles to release. It is best if you can have your back supported. So maybe in front of your sofa, so your back can relax against a surface. So the only thing again that has to be contracting is your hand that's doing the actual therapy. So starting again in this position, putting your hand here to the side, you're relaxing backwards. I'm only turning so you can see what I'm doing, and otherwise you'd be square. And you're holding your finger into the good hurt spots. When I say seam, I don't mean a thin line. I mean a band, like sweatpants that have the old white bands up the side. That's the distance, the width of the area I want you to work. It might be a little higher, it might be a little lower, but you're looking for those good hurts, those bruisey, tender spots, which is hypercontracted tissue. I want you to hold it, breathe, and mentally let it release. Give it permission to unclench. Work your way all the way up the side of your hip. When you get into the side of your hip, again, you may want to lay down. Using your hand into the side, continuing on the seam, compressing, holding, disengaging. Compressing, holding, taking those deep breaths, disengaging. It's so important to mentally focus on what you're doing, to breathe through it, and continue all the way up. Once you get to your side, you can turn your hand into a fist and push your thumb or a knuckle or your finger or two into the seam. So you're pressing in, again, looking for those good, hurt, bruisey spots, compressing the tissue. Hopefully that takes some of the edge off. You would also do some of the inside seams, same thing. Back supported against your sofa, holding the hand on the outside, compressing only with the inside. You're going to push in to the seam. You're looking for good hurt spots when you find one. Nice slow deep breath, disengage. Literally feel the leg roll and release away from yourself. That should give you some relief. Between the working in the glutes, working in the seams, and the other would be working in the quadriceps with that rolling. One more thing that might be beneficial is taking your fist and using it in your quadricep. You're looking for, you're feeling for those knots. Those are muscle fibers that are hypercontracted, causing imbalance. In the whole way, all of this muscle structure is balancing and holding your pelvis. I know you feel the discomfort in your low back. I know you feel it in your hip. But these are just a few things that might help you. You could also call 419-261-4142. Leave your name and your phone number. I'll be happy to call you and walk you through these steps. I just didn't want this video to be too long, but to give you a few things that you could do at home. So good luck. God bless. Remember to stay focused, breathe deep, and ask God for help. We'll talk to you soon.